Hi everybody, Walt Fritz from Foundations in Manual Therapy, Voice and Swallowing Disorders seminars. For the last decade or two, there's a question I've asked my patients, and for the last decade or two, it's a question I've included in a lot of my in-person workshops, trying to determine the individual values of another individual. The question, does it have to hurt to help, is a sort of an opener there. Does it have to hurt to help? Does manual therapy, myofascial release, massage, laryngeal manipulation, does it need to be aggressive to help you? Or exercise, does it need to hurt to help, right? Evidence is not clear, especially for manual therapy, because a lot of manual therapy styles are more assertive. Laryngeal manipulation, to me as an individual, is aggressive. It's aggressive to the point, at least the times I've had it done to me, it seemed too aggressive for me to simply absorb and reflect on. It was too much. It didn't allow me the space to say, no, back off a little bit. It also didn't allow me the space to say what I feel. But I know other people who it has to be aggressive or hurt to help. Now, that question, does it have to hurt to help? We don't have to quite word it like that because it can sound a little bit like you're trying to corner somebody or even condescending or minimizing. I don't want to judge a person for telling me, yeah, Walt, I think you need to go more aggressively, because those are the unique characteristics, the context that we're looking to apply an intervention in. Because our work, whether it's exercise or manual therapy or education, it's much more than the tool that we think is the effective reason for change. Leah Halou in her studies on metatherapy showed that what we think is the driver, right, the technique, the modality, is only part of it, that it's the meta that we surround it with. And to me, the meta of manual therapy and exercise that I use and teach, it is the shared decision making. It's allowing my patient a voice in how we do things. Whether we're in the right area, the right direction, the right level of force, or just a host of other things. Instead of me being the arbiter of decision-making, I encourage my patient to help me. All right. Now, there are certainly times when I think work can be too aggressive and we risk injury. And I need to explain that to my patient, even if they're asking for more, a higher level of pressure. I need to share those concerns with them, but I also have to be careful in a shared decision-making setting not to judge. I do have my endpoint where I will not exceed it safety-wise, but I'm willing to flex. I'm willing to flex in the direction of my client, my patient, and add more force, add more quickness, move faster, whatever that might be, or conversely, level things off, even it out, soften, slow things down, to a point where it's like, I may question, would this help me? But that unique N of one person we're working with should have a voice. Because to them, if it's too aggressive, it won't help. If it's not aggressive enough, we won't help. Does it have to hurt to help? I don't believe so. But what about you? Do you think so? Just things to ponder, right? I'm not about beating the heck out of somebody, but I am about listening, respecting, and honoring their unique perspective on their past as well as their present. All right, thanks for watching. Bye.